Hello, my name is Chandler Garrett, and I will be talking about what I learned this week throughout reading about mental health and substance abuse disorders. So, one thing that I found to be really surprising was the simple fact that caffeine is, in fact, a stimulant. As a big coffee drinker, late night studying, all of that, it was definitely surprising to me when I dug a little bit deeper into understanding coffee as a stimulant and seeing that over 90% of Americans consume coffee, which seems like a really high amount of people in America that, partake in a substance that is very commonly abused and habit forming. So that was definitely surprising to me. One thing that was not surprising to me throughout going through this information was kind of understanding that mental health disorders cannot be discussed without talking about the risk factors for substance abuse disorders, as well as vice versa, and that substance abuse disorders cannot be talked about without discussing the risk of potential mental health disorders. So I think that's one important thing to kind of note and just keep in mind when discussing either of these topics. So three things that I learned about each of these topics for mental health disorders. I learned that panic disorders can be linked to genetics that lead to biochemical abnormalities. This was really just surprising to me because I had always thought that panic disorders were linked more so to kind of environmental stress or just prolonged stress in general, whether that be a life event or just a traumatic event that's happening. So that was interesting. I also learned that bipolar disorder is a subgroup of depression. I really, kind of treated them as two different things prior to going through this information. So it was interesting to see that although we have your manic state and your depressive state with bipolar disorder as a whole is a subgroup of depression. And lastly, that depression can be a result of a diagnosis with medical conditions. I thought this was really interesting just to take a deeper look at because we don't commonly think of someone potentially having depression as a result of being diagnosed with diabetes or being diagnosed with hypertension or whatever it may be. And although, diagnosis with something like cancer definitely would go hand in hand, it's really not talked about, I feel like, enough that other diseases, other medical conditions can lead to depression as well. Three things with substance abuse that I learned is that substance abuse can be linked to family practices. I think this is also important just to note that really, what you do around your children and your family really can have negative effects. And I think it's important to recognize that family practices do play a very large role in substance abuse disorders. Also, the use of methadone and antabuse can be used to aid in rehabilitation. Um, you know, Typically you hear about kind of going cold turkey per se when you go into or an individual goes into a rehabilitation center. So I found it to be very interesting that we are actively using different forms of treatment or pharmaceutical treatment with methadone and antabuse to combat opioid addiction and alcohol abuse. And then lastly, contaminated needles are a major source of infection amongst drug users that can lead to systemic complications if left untreated. So, of course, we know that contaminated needles can lead to hepatitis B and HIV. However, I think it's really important to note that it's much bigger than that, and that so many infections that go untreated, whether that be gangrene or just a local infection that's left untreated, it really can become something more systemic and develop into sepsis. And then, herein lies a much greater problem. So I think it's just important to note, to recognize, and, to also be aware of the need for treatment if you ever were to, come across someone who uses needles for any substance abuse disorder they may have. So I am currently enrolled in the Women's Health Nurse Practitioner program here at Regis, and kind of emphasizing women's health and mental health and substance abuse disorders. I think it's important to note that depression and anxiety are more common in women. So knowing this, I think moving into my role as a practitioner, I have to be willing to distribute resources and letting clients know about hotlines and text communication numbers that they can reach out to in the event that they feel that they're in crisis, that they need help, and they need immediate attention. I think it's important to have these resources kind of readily at hand, to distribute them in both a paper form, as well as be able to have an open conversation with my clients that I see, and be able to kind of assess and see if a resource of this subject matter would be necessary for clients. I also was able to read a little bit about the LGBTQIA community and how young adults, specifically within this community, really have an increased risk for substance abuse and alcohol misuse disorder. So just kind of, being able to outline risk factors when assessing my women's health clients, I think is really important in kind of staying on the forefront of like prevention methods, and, you know, making every effort that I can to reach out to my clients. So that's what I learned this week. It was definitely an informative week, and I am grateful for all that I learned. Thank you, and let me know if you have any questions.